I'd like to talk to you about the different types of fat that we find in the belly and the way that you can treat that fat with liposuction or with weight loss. Now there's two main kinds of fat that we can see in the abdomen or the belly. There's the fat that's underneath the skin. We call that subcutaneous fat. And that fat is the fat that you can grab with your hands. It's the fat that's in front of the muscle. Now there's something else called visceral fat. That's the fat that's underneath the abdominal muscle. So if you feel your stomach wall, you'll feel something firm. That's your stomach muscle. There's fat underneath that that's around your organs, and we call that visceral fat. Now when the visceral fat has collected over time, when someone's overweight, it creates a roundness, and that fat, internal fat, puts someone at risk for heart disease. So it's in our best interest to have a low amount of visceral fat. Now what can we do about these two different fats? Here's a patient that had liposuction of her belly to improve her shape. Now she was overweight, and she had a combination of the fat under the skin that you can grab and the fat that's visceral underneath the muscle. So you can see she had these sort of stomach rolls, and she hated grabbing it, and she hated her shape in clothing. Now after liposuction, those rolls are smaller, and there's much less fat that she can pinch, but she's still round. And the reason is she has visceral fat, and the only way to reduce the visceral fat is by diet and exercise. So as she continues to lose weight, her shape will look better, but that visceral fat cannot be treated with liposuction.